Ozempic, Mounjaro, Wegovy, all household names when it comes to GLP-1s, otherwise known as weight loss drugs. But what's the real skinny on these medications? And is it one size fits all? Our Stanford Medicine experts give us their insights.
Obesity is practically an orphan disease from the treatment perspective. For the most common chronic condition in the country, having practically no effective drugs to treat it and only surgery as the only effective treatment until now is sort of crazy to think about that. So it's really a game changer.
What are your patients asking you when they're asking about GLP-1s?
They do ask me if it's right for them, but they're worried, do we know enough? So the medicines that really help. Because I think patients are worried that something's gonna show up later and then they will regret taking it. The good news about GLPs, I don't know if you knew this, but the first GLP that got approved was in 2005. So it's almost been, like 20 years of experience. So benefit-wise, it helps lower blood sugar, it helps lower risk for cardiovascular disease, decrease the risk for heart attack, stroke, and early death from heart disease. It's good for your kidneys, your liver. It's also indicated for moderate to severe sleep apnea. And then some other exciting areas that people are looking forward to: neurodegenerative diseases like Alzheimer's, substance abuse, like alcohol use disorder. I also tell patients there's no free lunch, meaning all drugs have side effects. The common ones: nausea, some people get diarrhea, some people get constipated, some people feel bloating. So those are the gastrointestinal side effects that are very common. Right now, people are very concerned about muscle loss. But I would say for most of my patients, at the end of the day, if you look at their body composition before GLP and after losing weight, it's actually improved.
Every single drug has some side effects. One of the reasons we hear about the side effects so much is the bias against obesity. So the threshold for a treatment is very different than for other drugs. Like if you imagine the magnitude of side effects that you have for drugs for cancer or even more benign diseases like high blood pressure and other things, everybody's fine with those side effects because the benefits are, of course, they're worth it. And obesity is, a condition that shortens your lifespan, that affects your quality of life. And if you start treating it, you have benefits like cutting your risk of having a heart attack or a stroke by 30 or 50%, depending on the treatment. So these are real benefits, and the side effects exist, but they're very manageable.
It's not about the 5 pounds. It's about a lifelong struggle with weight, and that weight has health consequences. Type 2 diabetes in a person at risk, heart disease, certain cancers. In that patient who struggled all their life to lose weight, these medications are literally life-saving.
Take it if you need it, not as a,
I need to lose 5 pounds by next week.
way to, get into your outfit for the next wedding you're invited to.